Good morning, everyone. This is Lisa Mason. I'm with the Prevention Training and Technical Assistance Service Center. My colleague, Jen Jacobson, and I are delighted to welcome two of Department of Mental Health and Addiction Services staff members, Danique and Daniela, to present this training, Cannabis Landscape Analysis training. Because as Jen mentioned earlier, cannabis is rated, I think, number 2 on our workforce survey of topics, or in the top 2 of topics, along with mental health issues that over 200 prevention professionals and others working or volunteering in prevention completed last fall. So we're delighted that they will be able to hear a quick few housekeeping details. One is this training will be recorded. We'll post it on our YouTube channel and send you a link in case you would like to share it or review it. It'll be available for the public. So if you want to share the link with others, you can do that. Our presenters are generously sharing their slides, so we'll be sending those out to you. If you stay for at least 80% of the meeting from 10 to 11:30 this morning, you will be eligible for CEUs. You will earn 1.5 CEUs, and we'll be sending those out to you as well. That may take a week or so. We have 90-something people signed up, registered. Right now, we have 41 people in the room, so that may take a little bit. Just because there's so many people in the room, we're going to ask everyone to keep themselves on mute. We will be monitoring the chat box and interrupting Danique and Daniela, or when they take a break, if there's any questions that come up. So please feel free to use the chat box. And if there's opportunities for discussion, you can get off you can turn off the mute at that point and talk. But I think just to keep things easier for everyone, we'll ask everyone to keep themselves on mute. Hey, Jen, is there anything I forgot for housekeeping?
No.
Okay.
Just that they'll receive the slides from today. So that's often a question that we hear. And yes, we will be sending you the slides.
Yep. Thank you. And we are talking with Danique and Daniela about follow-up opportunities as well for continued learning and to support folks. So we're thinking of that as well. So what I'm going to do is stop talking and turn it over to Danique and Daniela to present on the data that they've collected and best practices. So thank you, ladies.
Thank you, Lisa. So good morning, everyone. Thank you all for making time as part of your Wednesday morning to walk through our landscape analysis. So super excited to not only have you here, but to be able to talk a little bit about the data and kind of where we see this work evolving and how you can be a part of it as well. So just a little bit of background. So I am here with Daniela Montes Hawley. I'm Danique Venema-Lewis, the Behavioral Health Program Manager that's responsible for cannabis here within DMIS, and super excited to have Daniela here with me. Daniela is, as I say, the star. This is her project, and I'm so excited to be able to spend this hour with her. And I think that for those that may not have met Daniela, Daniela is a wonderful resource. I don't know, Daniela, if you want to at least come on and say hello, give a little bit more insight as to what you do within kind of the cannabis world.
Sure. Good morning, everybody. My name is Daniela Montes Hawley. I'm a lead special investigator at DMIS. So I'm leading the development of, like it says here, merchant education for the state as far as cannabis use. And I also partner with a lot of the state agencies, whether it be local or state police, as well as the Department of Labor, Department of Consumer Protection, Department of Revenue Services, to kind of get a multi-agency inspection process in the field to address some of the issues that are going on as far as cannabis use and just some other tobacco-related issues as well.
Thanks, friend. So other piece to know, just much thanks to other members of our Demas team. So Tom is in the audience today. So Tom is our primary prevention services coordinator who kind of rounds out our Demas cannabis prevention team. Also, huge shout out and thank you to Angela Duhane, who helped with the analysis of the data. And then overall, our TPEP team. So really being able to have a wonderful group of folks that are constantly in the field really has given us a lot of insight and support of looking at kind of what this landscape looks like statewide. So really just wanting to kick it off with that acknowledgement and appreciation. So what I also wanted to highlight, especially within my role within the cannabis team, is really talking about all of the different projects, how the landscape analysis works in tandem with kind of our other current projects. So I know that there are a lot of RBHAO cannabis coordinators on. Hey, friends. So we have kind of like 5 buckets of work that we are prioritizing for this year, namely related to capacity building and community awareness. So that's where all of our RBHAO cannabis work kind of lives, with the coordinators that have done thorough needs assessments, building regional capacity across the lifespan to talk about not only the prevention of underage cannabis use, but also really safe practices for our adult market. We also have launched our pilot of the Cannabis Coalition grants. So also super excited to have some of you as grantees as part of this opportunity this morning, and really excited to be able to have the opportunity to give dollars to really impact local communities. So we have 10 grantees as part of this pilot. They are impacting 20 communities statewide. So we are really eager to be able to see all of the wonderful work that will be coming through this process and all of the lessons learned. They are grant funded until the end of next fiscal year, June 30th of 2026. Other pieces just wanting to highlight our policy recommendations. That's done in tandem with our other state partners. So really making sure that we are helping to influence statewide cannabis policy and to making sure informed policy decisions. Our data and evaluation, so really recognizing the high priority data has within the prevention field, really making sure that we're measuring effectiveness, really identifying areas for improvement. So we do this on an ongoing basis within the work that's happening at the regional level. The example as today related to the landscape, and really making sure that we're continually refining the approach and really being responsive to the needs that are happening statewide. Other exciting piece you'll see underneath that data and evaluation is related to the International Cannabis Policy Study. So that objective and really our involvement in this is really to have a better understanding of the impact of cannabis policy, including just the impact of legalization, regulatory matters, product standards, retail policies. It's going to give us a wealth of information. We are in an eager anticipation of receiving the complete findings, and we are looking forward to summer of 2025 of this year to be able to have a comprehensive report and to share it with our other state partners. So also know that that is another large undertaking that we are embarking on as well. Hopefully, many of you have seen the Be in the Know campaign, which is really related to our public education. So really Be in the Know is supporting and providing objective research-based information around cannabis, talking about the effects, practical solutions and resources to mitigate harmful effects, as well as very segmented audience messaging for young people, parents, and pregnant and breastfeeding individuals and general public. And I'll talk a little bit about something that is coming up, especially in relation to 420, which I hope that all of you will be excited to be a part of. Also kind of tied to our public education work, we wanted to make sure that having access to safe storage cannabis lock bags continued to be a priority. Over the past year and a half, we've already given out 5,000 lock bags statewide. And that is just the 5,000 through Clearinghouse. That's outside of even the RBHAO's kind of outreach. So we know that really being able to ensure safe storage is something that is a part of the campaign that we're constantly talking about, but really making sure that this continues to be a free of charge resource to parents, to Connecticut residents. We really want to ensure that safe handling of cannabis at home. And then really kind of the purpose and intent of our time together is really related to retail education. So as Daniela has already mentioned, she is stewarding this effort, really making sure that we're implementing cannabis retail education and compliance, and making sure that retailers are complying with state law and regulation, promoting public safety, and reducing harm. So some of the other pieces that have already gone into effect are related to developing a compliance inspection protocol that helps to support Daniela out in the field, as well as making sure that it's in adherence to state regulations. And then, as Daniela has already highlighted, all of our other regulatory state agencies, really important partnerships that are happening to just enforce compliance. So that's really where our landscape analysis kind of comes into play. It's an opportunity for us to continue to develop and refine retailer education, as well as to give insights of what is happening in the field. So with that, I'm going to give you an overview of how we're going to spend the next hour or so. So we're going to talk about the why. So why was it necessary? Why did we decide to embark on this project? We'll talk a little bit about methodology, process, and data related to the landscape analysis. We wanted to make sure that if we were going to do this on a statewide level, we wanted to provide the opportunity for local replication. So really an opportunity for you to be able to prepare to potentially do something like this on a local level and what you can expect in the field. We always want to end our conversations with how to report establishments. This was a point in time. There have been a lot of things that have changed since last summer. So really also wanting to highlight some of the current cannabis laws that have come into effect, especially after the landscape analysis, and to answer any questions that you may have after this. So as Lisa has already mentioned, please utilize the chat. We would love to answer as many questions that you have and are always open to offering one-on-one advisement even after this program. So with that, we'll talk a little bit about the why. So before the landscape analysis, we thought that it would be really helpful to not only see what's happening, but these were some of the scary pictures, as I call it, that Danielle is constantly showing us from what she's seeing in the field. And it kind of boiled down into kind of 5 areas. So THC beverages, those were new to the market last year. They were outside of endorsed liquor stores. So really the presence of unregulated cannabis infused beverages were being sold without proper insight. So we wanted more information. Those familiar looking products, I'm sure that all of you agree that we're seeing products come on the line constantly. So really just wanting to mitigate any of the potential appeal, especially to our underage young people, or for people that may not necessarily recognize that these products contain THC. High potency products. So this present of ultra high THC content really raised concerns around overconsumption and adverse health effects for those, especially over the age of 21. Additionally, those out-of-state products really highlighted the challenges in enforcement and consumer safety, since they did not adhere to Connecticut cannabis regulations. And Kratom. So Kratom was something that especially our TPEP team last year were diligently watching. So really having this a part of the landscape really brought a broader emphasis on some of the unregulated substances that were sold alongside THC. So really excited to have you all kind of walk through the methodology and to be able to talk a little bit through our results. So with that, I'm going to turn this over to Daniela.
Thanks, Danique. So like Danique discussed, some of the purpose here was to determine the types of cannabis and THC products, which aren't limited to edibles, vapes, the flower, and infused seltzers that are available to purchase throughout the state of Connecticut. I went through a list of all the available retailers in the state of Connecticut, which was over 5,500 businesses that sold tobacco products, vapes, and the liquor stores that might have THC infused seltzers. And then we brought that down to a list of 358 retailers with a 95% confidence interval level. So we were able to double check, make sure that we didn't have any duplicates. We removed all of the major like box stores, so no Stop and Shop, ShopRites, Family Dollars, Dollar Generals, things like that. So it was more so like the gas stations, the convenience stores, and the smoke shops, and some liquor stores as well. As I mentioned, our targeted audience inspections were the tobacco, vape, and liquor retailers. And as far as the process, before I got out into the field, we made a Microsoft Forms that was able to be edited with all the questions that we wanted answered. So we will discuss that in the next slide. But so my process for this, once we figured out the 358 retailers that I would be visiting, and the questions that I would be asking, I would go into the establishments, would not announce myself or who I was or what I was doing, just kind of looked around to see what products were available, what products were legally sold, stuff like that. So we'll kind of touch base on that as well. It's important that whoever is doing, if you do a landscape analysis or something of that nature, that whoever is doing it has access, all the people that are involved have access to that Microsoft form. So you're all able to put that information in. And then at the end, it actually converts it into an Excel spreadsheet, which was very useful. So Danica, thank you. And then these are some of the questions that we came up with that we thought were important to address. We had the date that I visited the establishment, name, type of establishment that it was, address, town, city, zip, and then what licensed products did they have? Whether it was just cigarettes or did they have cigars? Did they have vapes? Did they have roll your own, hookah, oral nicotine, all the array of tobacco products that we see on the market? And were there THC products? And if so, what were the types? Whether that be the flower, edibles, vapes, etc. Were kratom products present in any of these stores? Whippets was also a big topic that we see. There's also a bill that was proposed for this legislative session in regards to whippets. So we wanted to see what it would be like out there as well, if they were present in any of these stores. And then if you didn't complete the inspection, what was the reason for it? And then if any other side notes that you wanted to put in there, we did that as well. And then these are some of the results that we saw for THC for establishment wise in all the different regions. So region 1, we had 19%, region 2, 22%, region 3, 12, region 4, 29, and then region 5, 18%. These are the number of establishments by region that we inspected. And you have to remember that some regions are more densely populated and more densely have more retailers in general. So that's why some of the numbers, like for example, region 4 has 102 that I inspected, whereas region 3 has 42. But these are the number of the breakdown for each region that was inspected out of the 358. Nick, if you would go to the next slide for me, thank you. And then a percentage of illegal THC per region. So in region 1, we saw 19 out of the 69 stores that I did. Region 2, we have 24 of 79. Region 3, 4 out of 42. Region 4 is 16 out of 102. And then region 5, 9 out of 66.
I wanted to talk a little bit about the 5 Connecticut's. As we randomized the sample, we were very mindful of the 5 Connecticut's. I put this slide here just in case there may be folks that aren't as familiar. So the 5 Connecticut's, it refers to distinct and separate socioeconomic trends within Connecticut. And it helps us understand the experiences of people across the diverse communities. So I gave examples here, and I tried to pick one from each part of the state. So really kind of speaking to a little bit of what we would expect from rural, suburban, urban core, urban periphery, and the wealthy communities here in Connecticut. And this is also kind of how THC broke down within the 5 Connecticut's. So establishments, they're highest in the urban periphery, as you can see, 122. And then it's followed by urban core at 104, suburban 76, rural communities 40, and wealthy 17. So the THC illegal sales, so that blue bar, were the highest in urban periphery at 27 and suburban areas. So interestingly, urban core has the lower level of illegal THC sales in comparison to suburban and urban periphery, even though it has despite kind of the density and establishments. And then illegal THC sales are lowest in the wealthy and rural areas, which align to kind of the number of or the lack of establishments in those areas. So I think what this demonstrates, as well as some of the other slides that we have here in the slide deck, is the urban periphery and suburban areas are always on our radar. And I think that it's an opportunity for future exploration. So is it an opportunity to look at policies, really talking a little bit more to enhancing police enforcement and partnerships. So all of these pieces are kind of components that we thought through as kind of we were building this process, as well as within the analysis of the data. And I'll pass it back to you, Daniela.
Some more results that we saw now in regards to something other than the THC that we were looking into, kratom. So it was something that I saw pretty often. So in region 5, we have 12, 4, 30. Region 3 is also 12, region 12, 27, and region 1, 20. So as Danique described the 5 Connecticut's, it kind of breaks down into each percentage here. So that number. you can kind of see the percentages here and how that would break down. Whippets, something that is a hot topic, as we know, that's being brought into legislation. Rural had I saw one, suburban 5, urban core 5, urban periphery 8, and then the wealthy areas 1. And then just an overall look of what the data looked like out of all 350 businesses. So 40 out of the 117 liquor stores that I visited, which is 34%, were selling THC infused seltzers or energy drinks. That's regardless of whether or not they had the endorsement, which would be through the Department of Consumer Protection, which they would have to register in order to be selling those THC infused beverages. 72 of the 350 establishments, or 20%, were selling illegal cannabis. 101 establishments, which are roughly about 28%, were visibly selling kratom. And 20 out of the businesses were selling visibly whippets, which is about 5.5%.
All right, so we're going to talk a little bit about considerations for local replication. We don't want this to just live kind of at the state level, but we're really mindful of how you all can both use the process and to do your own landscape in your local communities. So here are a couple of considerations, but before we get to that, I have a scenario. So really would love your feedback. So if you want to come off mic, it would be great to hear what you would say. So if you were in the field, you're entering a vape shop, you ask for a cannabis product and the merchant says, well, you're not with the state, are you? How would you answer? So what creative way would you answer this question if posed to you?
So when we do in Milford, when we do our landscape surveys, I say I'm a parent first, and I actually don't work for the state, so that's an easy question for me to answer, but I do tell them that I do work with the Milford Prevention Council, and I let them know that I'm there just to see what is available to youth in the community to share with parents and concerned community members.
I love that. So Kim leads first as a parent, but then an opportunity to talk about local efforts through the Prevention Council. I love it. Any others? Pretty straightforward. Other things, and I'm sure Daniela, you may have more insights too, that you might want to expound on, especially around what to expect in the field. We want to make sure that if you are interested in local replication, that just safety is paramount. So really making sure that you do this in pairs or in teams is our recommendation. And then as always, if a location feels unsafe, like it's okay to leave. I think that even within the process that Danielle went through with even the statewide landscape, there was that consideration for, you know, if safety was a concern. So always be mindful of that. Kind of what clerks will typically ask within kind of an establishment. So like, what are you looking for? How can I help you? Do you smoke? What do you smoke? So, you know, they are customer service minded. So a lot of these questions will be kind of common and will be posed. So, you know, I think Kim's example of really highlighting kind of why this is done out in the field. Other things, if you choose not to disclose, you know, talking about you're new to the area, you're curious about what products are available. So it's your choice if you want to keep yourself anonymous, but really ensuring that good relationship with the business community is important. So they're more than happy to answer questions around products. And as we've seen out in the field, there is plenty to be seen. Also be mindful of that as well. I don't know if Daniela, if you had anything else before kind of I move to the next slide.
No, that's pretty much it. It's just we want to just make sure safe. We always say safety is our number one priority. Not that anything is anticipated to happen, but just, you know, just be mindful of how clerks might take questions, or if you're prying, or if they've had history with the state, or penalties for illegal THC use, they might be a little bit more on alert. So just be mindful of that. That's all.
And then how to report establishments. So within all of our presentations, we want to make sure that folks know, like Daniela is a wonderful resource. You know, feel free to email her. I see in the chat other folks are like, Daniela's great. And it's like, yes, that's great. If Daniela can be of support, or any of us here within the division can support local efforts, please let us know. Other pieces too, just like if you're looking for like, well, what retailer has what endorsements, you know, whether that's tobacco, alcohol, if they can sell lottery tickets, all of those pieces are found via e-license. So really just wanting to make sure, and that may be also very helpful as you're kind of creating your own list of the retailer establishments. So really just know that that is also a wonderful resource that's provided through the DCP website. And then really, if you're out and about, even if it's not a part of the landscape work, you know, how can you really report? So wanting to make sure that you all had the general DCP cannabis email. So really it is anonymous, and there are a lot of opportunities that we've had over the past year or so working with DCP where they've been able to do follow-up based on what tips they've gotten from the field. Daniela, anything else that you want to highlight before we move on?
I think we're good.
All right, we're good. Well, then I'm going to pass it to you just to talk a little bit about cannabis law.
Okay. So we're going to go into some changes that have been effective since I've done landscape analysis. So infused beverages, effective October 1st of last year. The beverages can no longer contain more than 3 milligrams of THC per container. They must be at least the 12-ounce containers as well. They can't be sold in containers of more than 4, or packages more than 4, I'm sorry. Which also, part of that endorsement, there is an additional $1 per can in order to sell these. So if you're buying a 4-pack, that's an extra $4.20 because of or now it's more because it's 10 cents a bottle, but an additional amount just to have the THC beverages. And they can only be sold at licensed, at licensed cannabis establishments or package stores with an endorsement through the Department of Consumer Protection. They also have to have the 21 plus visual on the can. They can't have any synthetic cannabinoids, so the THC, P, HHC, anything like that. And they can't be labeled in any way that resembles cannabis for sale in the state, or any commercially available food or beverages that normally doesn't contain THC, or something that appeals to individuals under the age of 21. They also, just like the cannabis that's legally sold in dispensaries, it should be like a white container, not colorful like this one is here. So that's no longer allowed. Going into some synthetic cannabinoids, they are prohibited in the state of Connecticut. They're artificially and chemically produced, and they can be dangerous. They're legally defined as any material, compound, or mixture or preparation which contains a substance and acts as a naturally occurring cannabinoid that is produced artificially and not derived from the organic source. So like I said before, a couple of the examples here: HHC, HXC, THCO, THCP, and there's a numerous other amount of synthetic cannabinoids out there. Also, Public Act 24-115 also classifies them as a Schedule 1 controlled substance as of June of last year. Something new that came into effect as of January 1st of this year, moderate THC hemp products are now classified as 1 milligram per serving or 5 milligram per packaging. You also have to have a license to sell these products. It's a $2,000 license that you would get through to the Department of Consumer Protection. And you'd have to prove that 85% of your sales would be that moderate THC product. So the low THC product has now moved from 1 milligram to half of a milligram. And those can be sold without a license, which would be less than that 0.3%. So similar to some of the other things we discussed, it can't contain synthetic cannabinoids. The packaging has to be like a simple white packaging, no misleading any statements, brands, designs. It can't have a resemblance to a trademark or packaging of a cannabis product or commercially available product other than a cannabis product, and it has to be under that 0.3% dry weight basis. We got through that quick, Danique.
I'm telling you. So what are your questions? Do we have any questions from the audience?
We do have some questions in the chat box. The first one was, is there a specific contact at the clearinghouse that they can reach out to for lock bags?
Probably Amber. Amber has been my go-to person for lock bags. Also know in relation to the clearinghouse lock bags, we are in the process of procuring more. So our lock bags are going to change. Right now, there is a choice between kind of a flat pack and a larger kind of 5-ounce kind of version. And we're going to move forward with one bag. So those will be available hopefully in time for the summer. It also has Velcro on the inside in addition to just the locking capacity. So we're hoping that even if unlocked, it provides an extra barrier, especially for little hands. But yeah, Amber would be kind of the best person. Other pieces too is that lock bags can also be accessed through most of the RBHAOs, but also recognizing that the RBHAOs are doing their own resupply as well.
Okay, how do manufacturers get away with using recognizable branding, like on the THC Snickers that looks like a Snickers? Do you have any information on that? They just brave, or?
From what we've seen, yes. We have had one instance where a company has been sued for using a similar image to the Starbucks. They called it Starbuzz. So that has happened, but that's the only one that I've seen that has had repercussions for using those types of branding.
Thank you. Someone asked if all the products that you showed in one of the earliest slides were all found in Connecticut stores.
Yes, all of them were.
Okay, great. Is there a way to see a list of what establishments were inspected, or is that private information?
Good question. We haven't really talked too much about it. So We are still developing a document, a larger document that kind of covers a lot of what we were covering with all of you. So that will be something that's taken into consideration. The only other piece is, the establishments were just randomized, so it's not necessarily, but we'll talk about it. We'll talk about it offline. Great question.
Someone asked if it would be okay to use your slides and presentations that they'd like to give as long as they give you credit for your work.
I think that for these slides, everyone will have access to these slides. So, information is power. I think that the biggest piece that we want to ensure is that for those that are using these slides, that you really understand the context of the data as well as the law piece. So really just wanting to encourage folks to work with their RBHAO cannabis coordinator and or reach out to Daniela, because we want to make sure that if you are dispensing this information, you're dispensing it as accurately as you can.
Great, thank you. And it's important for people to understand the context of where some of the data comes from. We had a question about, has the state started doing state level compliance checks with cannabis like they do for tobacco, vapes, alcohol? Or is this like a next step following this, the work you're
Yeah.
doing here?
That's kind of something that's next step. There's nothing implementation wise as far as like, how tobacco compliance checks, we do the undercover youth to do that. That is not something that we're doing yet with cannabis. All the compliance checks that we are doing would be just with state agencies going in to double check to make sure that they're compliant as far as illegal products.
Excellent. And I think we may have some hands raised. If there's people who would like to jump in and ask a question.
Yeah, I've seen Jen's hand up for a little bit, so go ahead,
Thank
Jen.
you.
Hi, yes, Jen Jacobson. I was wondering, and this might be a future issue too, if you noticed any trend lines in your analysis on correlational in terms of any zoning variances between the communities where you found these things. So we know some communities are passing tighter zoning restrictions or aren't allowing any cannabis establishments in their communities. And I'm just wondering if you saw any correlational outcomes to that or not, or if that's just a future item that would be super interesting to understand. Thank you.
You know that it'll be in the report. But I think that those are always like the future pieces. And we're already starting to think through, okay, so we did this last summer. So what does this look like moving forward? So I think that as we continue to work through this process, it's like, how do we continue to improve, as well as to embed more of those questions, and also other emerging trends that we'll see probably this summer that may not have been a consideration from this last one too. So yeah, more to come.
That's an important policy conversation. So I'm just wondering if we have any evidence behind that. So that would be great. Thanks so much.
We have a question from Jason, or he has his hand raised.
Morning, Jason O'Connor with the New Milford Youth Agency, and good to see you, Danique. Question: Are the phones going off? Are the prohibited cannabinoids? Do those also include the delta 8s, 9s, and all of those kind of segments?
If they are not naturally derived, then yes, they are not allowed. Connecticut doesn't allow Delta 8, 9, or 10 because they're not within those allowed products because of their synthetic cannabinoids, yes.
So if we see any Delta 8, 9, or 10s within gas stations or any of these convenience stores, those are illegal products?
Yes.
Thank you.
Are there any other questions, or did we get through them?
We got through everything in the chat box.
Okay, great. I know the other, oh, Cassie?
Hi, I just had another clarifying question for things related to compliance checks. So, are they now looking for THC infused drinks at alcohol compliance checks? And I also wanted to confirm that those would be illegal for alcohol retailers to have the THC products.
If you have an endorsement for THC infused beverages that you apply through DCP at a liquor store, then you are allowed to sell them as long as they meet those requirements for the no more than 3 milligrams in the 12-ounce container. So as long as they have those endorsements, then they are allowed to sell those. I do not believe that they are doing alcohol compliance checks with youth in regards to THC products. That's not something that DCP's liquor control is currently doing.
And is the endorsement something that would be obvious or visible as anyone is walking into the store, or it's more of a formal document that might be tucked away somewhere?
It would be like a license. You can actually look up on e-licensing on the website based on your town. You can even see like what businesses have endorsements.
Okay, thank you.
Yeah, you're welcome.
Great questions. I think the other piece too is just because you may not have questions now, there may be something that kind of simmers after this presentation. Please feel free to reach out to us as well. Other thing that I just wanted to cover, especially since today is April 2nd, and we know that 420 is around the corner. Wanting to highlight this for all of you, you will be getting a lot of kind of newsletter and alerts if you are already subscribed to the Be in the Know newsletter. But we are or have developed 420 specific marketing tools that will be available on the toolkit in the coming week or so. So really wanting to just highlight not only are we, and hopefully you all are seeing, especially over our digital spaces, some of our billboards have gone live, that we have new materials as part of the Be in the Know campaign, which will all be available via toolkit. And if you haven't already subscribed to the newsletter, this is a wonderful time to just be able to access kind of this new media. So also just recognizing that we have social media posts, we have posters, we're developing new fact sheets. So there will be a new fact sheet that will be going online related to parents of younger children, which is super cute. And we're really excited about. In addition, we're going to have more fact sheets and info specific for those within the healthcare field. So that is something that is currently under development, and additionally other pieces. So just wanting kind of as we close out our time with all of you, just know that not only are we a resource, but really just wanting to highlight the public campaign, and hopefully that this is an opportunity for you to be able to kind of use social media and kind of your community partners to dispense this messaging as well. So with that, we'd love to stay in touch. If you'd like to kind of directly link to our toolkit, there is our QR code, as well as our email addresses. So like I said, we are a constant resource for you and want to be. Please reach out also to your RBHAO cannabis coordinators. They're also really in tune with what's happening at the regional level. And if you aren't already a part of those regional cannabis conversations, then please do through the committee work. I also just added to the chat. I know that you all will receive the PowerPoint presentation, but we also did a one-pager for you that kind of gives you kind of the highlight of larger pieces of this presentation, as well as when Daniela had talked about the landscape questions, we actually gave a little bit more detail. So hopefully that will be something that is helpful to all of you. but want to thank you for your time and attention. And with that, I'm going to give it back to Lisa.
Danique, I do have a question. I have a quick question.
Mhm.
It's about the Being the Know campaign.
Mhm. Yep.
I don't know if Jason had reached out to you as one of our partners we're working with, but I know that the campaign in itself, I know the toolkit is already customized in such a way that you wouldn't want any other thing done to it. We're just very curious in the sense that is it possible to put on other logos? Because one of the avenues to reach out to people in the community is that we also want them to know that this is coming from, even though it's coming from the state, but it is also coming from a town and a local agency. Can we put on our logos on the stuff that we are going to be generating?
Great question, Mary. So we are literally having a meeting on that with the RBHAO coordinators on Monday. Because, as somebody that many, many years ago did local work, you want to be able to recognize your local partners as well as make sure that folks know that, yes, this exists at the statewide level, but this is impacting our work here. We just want to make sure that everyone has specific direction as far as how many logos, what should it look like, because we want to ensure brand recognition. And sometimes without kind of proper guidance, sometimes it goes sideways. So there will be more guidance with it literally within the next week through your RBHAO coordinators. So please reach out to them probably midweek next week after kind of we have this discussion internally. But yeah, great question. And also know that and this is for anyone, if you would like to personalize, we also are more than happy to do that in-house as well. So if you're like, oh, I'm not quite sure if I can do this, send it to us. And we're happy to kind of help support that effort as well. Okay.
All right. Thank you, Danique.
You're welcome. Okay. And now with that, I'm going to pass it over back to you, Lisa.
Thank you. Thank you so much for sharing the results of the landscape analysis study you did and some best practices. If people were interested in replicating the work that you've done at the local level, should they connect with you at the state? Should they connect with RBHAO coordinators, cannabis coordinators? What's the best thing for them to do for next steps?
It can be a both and.
Okay.
So I think that, really being able, I think from a regional level to know kind of who's doing what is helpful for the coordinators, and the coordinators can provide additional support. And then, kind of where we fit into kind of that work is that if there are questions that arise through kind of the local replication process, then we can also help with additional guidance.
Okay, and if they find illegal products, they can contact the number that you provided in the slides. Okay. Is the forms that you all use for data collection, are those available for people to use at the local level, or would they need to design their own forms, or do the RBHAO contacts have forms?
Daniela, that's a you question.
So I formulated a form on Microsoft Forms, and that way it's super easy to use. But also, if you send the link to, say, it's a couple of you doing the landscape analysis or environmental scans, all of you can enter that data, and it all goes to the same place. So that is great. And then Danique did put the additional resources there, and it kind of has the list of all the questions that we came up with that we thought were important to look into, and what our study discussed and evaluated. So that would be a good resource too.
Wonderful, thank you. Do people have other questions about replicating this work or what they've learned?
I do have a question. Danaik, I know that there was, I don't know if it was Daniela who had said that one company had been sued for replicating another brand. Is there something that the state is actively pursuing, to be a deterrent for, if you look at the Sour Patch and then the Stony Patch, it's almost similar and it's very confusing. Will the state be pursuing, like suing or going after those companies or doing almost the same things as other brands?
I'm not sure that it would be a state going after the brands per se. It might be like, say for example, like some of the Sour Patch Kids. We saw some of those are very similar. I think it would be those brands that would be going after the replication. But DCP, who is the regulatory agency that oversees cannabis and illicit cannabis sales, their legal team is very well aware of all of the replication that is going out there.
Okay.
Yes, Jen.
This might be a future thing too, Daniela, but for the 5 Connecticut's where you saw disparities in the results, I don't know if this is going to be a report item, Daniela, but did you find any causation in terms of, why would suburban or urban peripheral be variance to other types? Was there any type of insight as to the reasons for that? Like, was it an enforcement issue possibly, or awareness issue, like training issue? So no causation at this point, but that's another interesting thing for us to try to understand on a regional level, is what that why those disparities look like that.
Yeah, and I think it's also important to note that it's hard with different towns and cities, as far as enforcement, as far as police involvement, as far as police might want to be involved, but maybe the courts are saying we're not going to prosecute the illegal sales, or maybe the police departments just don't have the manpower to join us on these inspections.
Okay.
So I think it's a culmination of a variation of things.
I wonder too if it could be market driven. There's more population in some of those communities than in the smaller or rural. And also, is it a competition? I noticed some of those had more retailers that you inspected. So could it be competition among retailers? But that's just
Yeah.
me guessing.
It can be. It could also be like maybe some. We often find that a lot of smoke shops throughout the state are owned by the same person, so it might just be where those people have those businesses and they're just overstocking their shelves with those items. So it might just be who has it available and who owns the store.
That's interesting. Thank you for sharing that.
Yeah, of course.
Yep. If you check in the chat box, we have the RBHAO cannabis coordinators introducing themselves. For those who are here, would you like to turn on your camera and just say hello and introduce yourself?
Hi, I'm Kate Glendon. I'm the Rushford Prevention Rushford Prevention Manager at Meriden.
Chelsea, would you like to say hello?
Yes, sorry, we're at a college campus and I'm
Oh, I'm
figuring out tech. That's okay. I'm just in an unfamiliar place and getting confused. Hi, everyone. I'm Chelsea Kapitancic. I work as the Behavioral Health Program Manager for the Cannabis Initiative here at Western Connecticut Coalition. So we serve Region 5, so the 43 towns encompassed in Western Connecticut. We would love to connect, so feel free to reach out, put my email address in the chat, and I look forward to meeting with you all.
Thank you. Samantha from Region 2, would you like to say hello and introduce yourself?
Absolutely. Thank you so much. Hi, everyone. My name is Samantha Murcia. I serve with Alliance for Prevention and Wellness, which covers Region 2, considered South Central Connecticut. We cover 34 towns ranging from about the Old Saybrook area all the way up to New Haven, East Haven area, and everything in between. I'm more than happy to meet with anybody who would like to kind of align our efforts, so that way we can really be effective in all the work that we're doing. So I look forward to meeting you.
Thank you. Zach from Region 4.
How's it going, everyone? Nice to meet you all. Lisa, thank you for giving us the opportunity to kind of introduce ourselves. Danique and Daniela, thank you for an awesome presentation. I'm definitely going to be scouring through those slides later today, so thank you for that. But yeah, I'm the cannabis coordinator for Region 4. That's North Central Connecticut, so it's kind of that Hartford County and surrounding area. I'm seeing a lot of familiar faces, which is nice, but if we haven't had a chance to meet yet, then I encourage you, please just shoot me an email. I'd love to meet and see what I can do to help.
Great. Thank you, Zach. And Caitlin.
Hi, everyone. My name is Caitlin Comet. I am the program manager at Catalyst CT, the hub, Region 1 Southwestern Connecticut. We cover the 14 towns from Greenwich to Stratford, all those towns along the coast. I'm also the cannabis coordinator, so I put my email in the chat and happy to connect. We've got a lot of resources, educational opportunities, lockboxes, program materials, and more.
Thank you. And I'm not sure if Region 3 is represented. I did not see them in the box, in the chat box, but we can get the name for you. Do you happen to know, Danique, who the Region 3 coordinator is?
Of course I do. That's Megan Erdman.
Oh,
That's you.
okay. Yeah, Megan. Okay, wonderful. Thank you. Any other questions or comments or feedback from folks before we wrap it up? We will be sending you a link to the recording. We will be sending you presentation slides. We will be sending you CEUs. Danique posted a one-page sort of summary in the chat box. We will be sending that out, but you can download that if you'd like. We'll also include the address for the Be in the Know campaign email address, if that's okay with you. Danique, we'll put that in the follow-up email as well. I would like to thank our presenters, Danique and Daniela, for all of the work you are doing and for the information you've shared and the leadership in the state that you are providing. We look forward to working with you in follow-up steps. Jen, put in our evaluation. So if people would take a moment to fill that out, we would very much appreciate it to get some feedback on how we're doing and how we can be helpful. If you have requests for additional information for Danique and Daniela and want to pop that in the chat box or follow-up training and TA that either the RBHAOs can provide, we can provide, put that in the chat box as well. And we will take that under consideration and share that with the proper folks. Thank you all. We're going to release you early. So enjoy that half an hour that you have. And everyone have a good day. Thank you very much.
Lisa, you want to stop recording?